Hello friends, welcome to Expert Medical Coding. In today's video, we're going to learn about blood and its components. So let's get started. Blood is made up of four main components and they are plasma, red blood cells, white blood cells and platelets. So let's discuss more in detail about each component. Plasma. Plasma is the liquid component of blood that makes up about 55% of the total blood volume. Red and white blood cells and platelets float in your plasma. It's a light amber or straw-colored liquid that consists of 92% of water. Vital proteins involved in many functions such as blood clotting, fighting infections, and transporting substances make up 7% of the plasma. The remaining 1% contains mineral salts, sugars, fats, hormones, and vitamins. Plasma has several important functions in the body, including transporting blood cells. Plasma carries red blood cells, white blood cells, and platelets throughout the body. Maintaining blood pressure and volume. Plasma helps maintain the body's blood pressure and volume. Providing proteins for blood clotting and immunity. Plasma contains proteins that help blood clot and antibodies that fight with infections. Carrying electrolytes. Plasma carries electrolytes like sodium and potassium to muscles. Maintaining pH balance. Plasma helps maintain the body's pH balance, which supports cell function. Now let us discuss about plasma disorders. There are several rare conditions that affect blood plasma, including amyloid light chain amyloidosis, hemophilia and non-Willebrand disease, immunodeficiency, myeloma, thrombotic thrombocytopenic purpura. Now let us discuss about the next component, RBC, that is red blood cells. Red blood cells make up about 41% of the blood by volume. They carry oxygen from the lungs to the body's tissues and carbon dioxide back to the lungs. Hemoglobin is the protein in red blood cells that carries oxygen throughout the body and gives blood its red color. Red blood cells and hemoglobin are produced in bone marrow, the spongy matter inside many large bones. The average lifespan of a red blood cell is about 120 days. Now let us see some of the RBC disorders. Some of the red blood cell disorders include anemia, blood loss, bone marrow disorders, and polycythemia vera. Now let us discuss about the next component, WBC, white blood cells. White blood cells circulate around the blood and help the immune system fight off infections. Blood consists of two types of white blood cells and they are granulocytes and agranulocytes. Basophils, neutrophils, and eosinophils are granulocytes. Lymphocytes and monocytes, on the other hand, are agranulocytes. If you have a low white blood cell count, you're likely to get infections. If your white blood cell count is too high, you may have an infection or an underlying medical condition like leukemia, lymphoma, or immune disorder. Now let us discuss about the next component, that is platelets. The primary function of platelets is to prevent and stop bleeding. If a blood vessel is damaged, the body sends signals to the platelets which cause them to travel to the injured area. Once the platelets arrive at the site, they clump together to form a clot that helps stop bleeding. Now let's see some of the platelet disorders. Most platelet conditions involve having too few or too many platelets, thrombocytopenia and thrombocytosis. Please like, share and subscribe to Expert Medical Coding. Thanks for watching.